All right, we're now 30 seconds away from really something we've been very much looking forward to. It's part of a series of debriefs inviting you to think together about what we've done so far, what we've achieved with this Nigeria Movement for Immunization Agenda 2030, Immunization Collaborative, and then even more importantly, looking toward the future. What should the collaborative do in the future, and how and with whom and on what basis? Those are the kinds of issues we're interested in. And today we're pleased to hold the very first consultation of the Immunization Collaborative, specifically with women in the collaborative. So during the first exercise of the collaborative, we observed really remarkable leadership, starting with the General Assembly that kicked off, the launch event, that kicked off the collaborative on the 22nd of July, all the way to the final General Assembly on the 6th of August. This was, as you recall, the root cause analysis exercise. And this week we're doing a series of debriefs. We have upcoming debriefs with the guides on the side. We just completed an after-action review with UNICEF and NPHCDA, as well as, and we're also engaging with Gavi to see what together we have learned from this first peer learning exercise. But we decided with Charlotte to hold this debrief specifically for women. Now she herself is traveling, so the irony is that she's unable to join today, and had asked me if I could facilitate this meeting. But this debrief, the reason we're holding it is because we observed during the collaborative exceptional leadership and engagement and commitment demonstrated by women in the collaborative. And this is why we thought it was extremely important to take time to stop, listen, and think, and learn from you about your experience. And really, we had debriefs with organizational partners. That was on Monday, as well as a debrief for government staff, and so we're very much looking forward to this. To this, I'm going to mark a pause here and ask for someone who is in the room to introduce themselves and tell us what is on their mind. We have invited only women are in the room for today's session. So what would you like to say? Actually, except with one exception, and that is me. I hope you will accept me as your facilitator. If you could please raise your hand if you would like to share what's on your mind. What are your thoughts right now as we go into this consultation? I'm just going to share while you think about it. So please. Okay, wonderful. Fatima Husseini, a warm welcome to you.
Okay. Good afternoon, everyone. My name is Fatima Husseini. I'm the founder of Hajjafar Supportive and Development Initiative. Can you hear me, sir? Because
loud and clear. Loud and clear.
It's like it is echoing.
Okay.
Even though it's raining here. Okay.
No,
so how collaborating with strengthening women's leadership is number one. Women, we have less corruption. That's the first one. Secondly, if you ask women to do something that is related to children, she will make sure that she did it in the right manner. And it's very easy to control women in the field. Yes. Then thirdly is that any woman who engages herself in routine immunization, she's not only looking at the gaining that she will gain, but she's looking at the health of the children. Like, I don't know others, but to me, even last week on Wednesday, one child died at Simam Center. And 2 days back, there is one woman I saw her with her child. The body was so hot, I had to start with spongy child. And all these women are not taking vaccination. For me, knowing that the importance of the vaccination, I think it's very easy if we allow women to go deep into the immunization activities because especially in the northern part of the country where we have many issues of vaccine acceptance due to religion, due to culture, due to other reasons. I think if it is a woman, once you have a sitting with her, some woman will tell you that I want to vaccinate my child, but the husband say this, says that. And then we have an opportunity to mingle among them, unlike men. For example, being, let's say I'm a facilitator. Last month I was in Geneva. I saw somebody, a representative from national, and he wanted to vaccinate the children. But because of the culture, directly he cannot penetrate the women. So they are calling my attention to mingle with the women. So that's an advantage. And then third observation is that any woman who is willing to work under immunization, NGO should make sure that she has something related to health. Because you see somebody with English language, you take him to health sector. That one will not yield a better result, even if that one is a woman. So I think that's the observation I have. And if women chance was given to women, definitely there will be a change in immunization acceptance. Thank you, and over.
Thank you, Fatima Husseini. So that is a very powerful statement in general with respect to the role of women in immunization. Could you tell me what your experience was of participating in the collaborative? I don't know if I believe you did do the peer learning exercise, so the root cause analysis, but how as a woman, did you experience the collaborative, and what do you think the collaborative should or could do to really support you and your ability to do the work of immunization in your context where you work?
Okay. I have conducted an analysis during my root cause analysis. I did not even just sit down and write something which I don't know. As I said, I have 34 personnel across the 34 local governments in the state. So we did the research and I was able to identify why women are not taking vaccination. And equally, I have 10 years experience in immunization because I work with UNICEF and WHO, and all they are related to immunization. Yes, and during my activities, I was able to set an ownership in many places. So this is what arose my interest for knowing the problem, to see how I will address it. So I look at the collaboration as something that I will bring change to what is on the ground. So collaboration with agencies and other partners, I think it will be, sir, it has been echoing. I don't know. Maybe it is from my side or from yours.
So no one else is reporting the echo. It may be because you're getting feedback from your microphone if you have a loudspeaker. But thank you, Fatima Husseini, for this first contribution. As you know, we really strive in every event within the first 2 minutes to hear the voice of a participant rather than my voice or Charlotte's voice. And again, I thank you. This is a meeting for the women in the collaborative. I thank you for accepting me as your humble facilitator. Let's go now to Fanny Ogwu, and we're going to skip. I did want to recap some of the things about the collaborative, but let me go straight to the questions about women's leadership in the collaborative. Fanny Ogwu, a warm welcome to you. You are, of course, a longtime scholar of the Geneva Learning Foundation, an ambassador of TGLF, and also a leader in the movement for Immunization Agenda 2030. However, this was the first time that working with you and the amazing network of ambassadors, many of whom are women, we launched together this collaborative for Nigeria. So Fanny, I'm looking forward to hearing your voice, your experience of the collaborative, and really some of these questions. How can the collaborative help women be recognized as leaders in immunization work at all levels? So whether you work in the LGA, in the ward, in the facility, or at state or federal level. And then what can the collaborative do to show government and partners the good work that women do in vaccination? And then when should we plan our activities so more women can join? What can we do differently to make sure that the collaborative supports and welcomes women in the right ways, considering that women who work for immunization often have many other responsibilities? Fanny Ogu, a warm welcome to you. Looking forward to listening and learning from you.
Thank you so much. Thank you so much, Dr. Reda. Thank you for the beautiful introduction. Yeah, the opportunity of working in the collaborative has brought so much benefits, as in visibility for the women. Visibility for the women. What we are left to do is to ensure that we scale up, because like in my state, we found out that very few, about 3 or 4 local governments out of 25 local government areas of the state, Delta State specifically, were involved. So if we find a way of scaling up by way of advocacy, reaching out to other personnel, it will go a long way. So on my own and my own organization, we are looking at how we can work with the state government to get to know those organizations that are registered with the state that are into immunization, so that we partner with them. Thank you. Over.
Thank you, Fanny. And what could the collaborative do to better recognize, support women as leaders in immunization?
What will?
What could the collaborative, so really this group, this network of health workers across Nigeria, with the support of the Geneva Learning Foundation, UNICEF, and NPHCDA, what is it that we should be doing to better recognize women, the leadership of women in immunization?
I think one of the things that we need to do, because we are a people that cherish letters, introductions, and certificates. So if an organization like mine that is just budding is given a PEP by Geneva Learning Foundation, a certification that we are in collaboration with Geneva Learning Foundation, it will go a long way to boost our image and create some kind of trust. Thank you so much.
Understood. Thank you, Fanny. And so just on that subject, as you know, 628 organizations, primarily from the local levels, joined the collaborative. The first step was to fill out the application. The second step was for the organization, the partner, to issue a letter of endorsement. And you can see some of the letters here. And there's around 40 organizations that have done so. And then the third step is indeed for the collaborative to recognize the organization formally as a partner. So that is understood. Thank you for this contribution. Let's go to Maimuna Tata. And again, I'm going to recap in a few minutes the a little bit about the collaborative itself. But we wanted to start, as we always do, with your voices and your experiences in response to the specific focus of this consultation, which is really on the leadership of women in the collaborative and the specific needs, but also the specific ways in which you've expressed that leadership in the first few weeks of activities of the collaborative. Maimuna Tata, a warm welcome to you. What is on your mind, and what would you like to add to this consultation?
Okay, thank you. I am Maimuna Tata from Kano State. I think collaborate, and from the collaborative, women need recognition. We need recognition, because when you look at most of our programs in immunizations, the heads, or let me say, most of them are men. Why underneath, the women are doing marvelous work, which needs recognition. So if there should be something like a forum for the women, maybe a link where women who are part of immunization can register through that link. And then through that link, maybe there should be trainings, maybe online trainings, and then refresher trainings, capacity building for the women. And in the process of that, any woman who has done something that is highly recognizable should be recognized, I think, globally. I think with this, the collaborative can go a long way to help women. Also, there is something like, let me say, something like this gender inequality. So if maybe in an organization, women should be given priority because women deal with children. When women are providing immunization, they do it tenderly than men. So I think they should be recognized in such situation. When you look at some of our facilities or in an LGA, you find out that almost all the RI service providers are men. You find out that there is only maybe 2 or 3 females that are providing immunization, especially in the rural areas. So I think women should be given also this privilege to provide the immunization because they are more closer to children and they have that, what will I call it? They have that empathy within them. When I say, yeah, within them, they put they more recognize children than the men. So I think with this, also, I think, and also, what will I say? I think with all this, I think women can be you can help women to be heard at the top. Thank you.
Maimuna Tata, can I ask you how could the collaborative, so this network of health workers across the country, with the involvement of the Geneva Learning Foundation, UNICEF, and NPHCDA, maybe I should ask you, what would you like us as the organizational partners to do that could actually help recognize and support women's leadership in the collaborative? Is there anything specific that you would like to see us do? We heard from Fanny Ogwu the idea of certifying and recognizing organizations. You said connect, have a forum for women, offer training, capacity building, build those linkages. Is there anything else that stands out that we should or could do to better support women's leadership?
Yeah, like that's what I said. I said creating forums for women. Women should be recognized through forums and programs. Then there's this mentorship also. We can mentor through online mentorship. It cannot really actually be one-on-one. It can be online. So you now mentor the women, build their capacity in providing immunization. I think this will help.
Thank you very much.
Does that answer your question?
Yep. Thank you very much indeed. Now, I do want to mark a pause here just to explain. We jumped right in now, but I do want to explain a little bit about the process for the, not the peer review. I'm looking for, so first of all, who's invited to these consultations? On Monday, we held consultations for government, department, and agency staff. On Monday also, we all of the organizations that had applied to be partners of the collaborative were invited, and then today specifically the focus on women leaders in the collaborative. Now, I do want to just remind you what we were able to do together very quickly, and so. With this first peer learning exercise, working together, we demonstrated the potential for large-scale digital peer learning to address local immunization challenges across Nigeria. Of the more than, let me see, I'm just skipping around the slide, sorry about that. So over 4,000 health professionals connected from all over Nigeria, more than 300 LGAs with very diverse participation, but as you can see, less than half of the participants were women. 40% or almost 40% government workers, and then representation 65% from the LGA and facility levels. Now, 400 participants submitted draft RCAs and 278 submitted revised RCAs. So that's a 68%, what we call the completion rate. 308 completed 3 peer reviews, and 229 of you received 3 peer reviews for your work. And then over 600 health professionals through the first 2 days of sessions, including many women, learned to conduct RCAs on local immunization challenges. So that is some of the background to this now in terms of how today's consultation is going to work. You saw the questions that we shared on screen and in the chat. This is really an opportunity to shape the future of the collaborative and also to help us improve, to give us your feedback. This is really essential for for our direction. So going to display a question on the screen. If you can write your answer in the chat first, then raise your hand if you wish to speak. If you wish to speak, make sure you have good connectivity and check that your equipment is working. We suggest you write first and speak after that, or request to speak after that. We'll see. And then again, your insights will be shared with NPHCDA, UNICEF, and other partners like Gavi, and this is really to help us align the collaborative with your needs and priorities. And we really believe that together we can improve immunization outcomes in Nigeria. But I also want to say that the reason we're holding this consultation specifically for women, and there are only women in the room. I am your humble facilitator, and I hope you accept my presence and participation. But this is really for women to be able to speak to each other and to listen and learn from each other through this consultation. I do want to, before we go further, also highlight that we have a couple of resources that we have at the Geneva Learning Foundation. One is the collection that we call Women Inspiring Women, and I know there are many Nigerian women who contributed to this collection. This is 177 women on the front lines of health and humanitarian action who shared their messages for their own daughters or other young women professionals considering a career in humanitarian or global health work. So we hope this can be a useful resource to women in the collaborative. And then really, since 2021, and again, Nigerian women have been amongst the leaders of the Women Who Deliver Vaccines Collective at the global level. This started at Teach to Reach in 2021. We already have, as you can see, there's an event planned for March the 8th, 2025, International Women's Day. And one of the questions for you to consider, this is a global group of women from all levels of the health system, and I believe over 80 countries. And the question is, would the women in the collaborative be interested in forming a Nigerian chapter of this Women Who Deliver Vaccines collaborative? So that is something for your consideration. I'll share the link. If you're not familiar with the Women Who Deliver Vaccines collective, you can go to the page I just shared and meet some of the organizing committee. I believe if we scroll down to Nigeria, you can see there's actually quite a long list, including Fanny Ogwu, who's in the room, Chika Ofor, who also sent a message earlier, and many other Nigerian women who've been part of this initiative since 2021. I'll now go to Becky Tagbo, who's been patiently waiting to come in. And Becky, very much looking forward to your contribution to this consultation, specifically on on women's leadership in the Nigeria Immunization Collaborative.
Thank you, Reda. Thank you, everyone. I want to make a few points. Point number one is that the Geneva Learning Foundation has really given open opportunities to women to express their experiences, their views, and kind of a voice, giving them a voice, because if you just want, you register. So you don't have to go to an organization where the leaders will agree on whom to nominate to go and represent. So women are free to come out and be heard. That's a very big opportunity. Number two is that the virtual format of meetings also gives women a lot of opportunity to participate. So they don't have to go looking for permission to leave their homes or leave their organizations. They just connect wherever they are. Even if they are taking care of their children, they can still connect. That's another big opportunity. And I think that number 3 is that what the collaborative could do is to call for gender-related challenges. The way you normally send in your survey forms or something, and you allow members to fill it. This time you are just asking for all the women if they have any gender-related challenges. When these challenges are shared, these can be collated into themes. And based on those themes, you can then organize meetings where people can share experiences, kind of peer-to-peer education and sharing of experience on how those who had those challenges were able to overcome it, so that those who are hidden somewhere in one LGA, nobody to talk to, nobody to advise them, can really learn a lot and know how to go about their challenges. And number 4 is that women have potential for high and wide-scale impact when it comes to immunization. Somebody mentioned a little bit about it, the way they render their services with a lot of tenderness, but much more because they have a lot of influence on the family, on the children, both male and female. So that gives them higher advantage in terms of impact, the scale of impact. And then the next point is that you give the women voice and visibility. Through the TGLF meetings and the social media activities, women that otherwise would never have been heard by anybody, you give them such a voice. Just placing a sentence that they have made and is there on the net and everybody is reading it from wherever, that is enormous. These are people that nobody may have ever heard. The other point is that it gives women confidence and assertion. Some of the women have never really spoken to any audience until they join this platform. And then they begin to hear people speak, and then they can bold it and speak. You are already building a lot of capacity so that when they go to their communities, they are better able to assert themselves and make their contributions and their points known. Finally, my last point is that we can recognize as, I think somebody mentioned something like that, some form of recognition for women, at least in Nigeria, who are members of this platform, that have made significant contributions to public health. Thank you. I'm over.
Thank you very much, Becky Tagbo. Quite a comprehensive review, and I like the very specific, tangible recommendations. I recognize the leadership, precisely what we're talking about today for the collaborative. Thank you for this and the contributions so far. So next, we have Boma Otobo. Boma is another longtime scholar of the Geneva Learning Foundation and leader in the movement for Immunization Agenda 2030 that is working at the global level. Prior to the collaborative, Boma, we're looking forward to your contribution. What are your thoughts and suggestions, recommendations, ideas that you'd like to share with this group, knowing that it is only women who are in the room from the Nigeria Immunization Collaborative? I believe, the sole exception.
All right. Thank you so much, Dr. Reda, and thanks for the opportunity. I see your passion and the entire Geneva Learning Foundation group. We're so grateful for your support. Mine is going to be a quick one. One area that I feel women can actually assist themselves is for you to take the bull by the horn. And what do I mean by that? There is a position in the various states that are so powerful, but for some reason, when it comes to health, they are not really in the forefront, and that is the office of the First Lady. Right? So if we can lay our hands on them through advocacy, through the Honorable Commissioner for Health, who should also be carried along, you will find that they play a very major role. So we can visit them, advocate to them, and actually tell them what we want as women to see in health. And I'm sure by virtue of their closeness to the governor, once they're able to, through the back door, get the governor's listening ears, I'm sure all of these changes we're recommending will come more speedily. So I would just want us to explore that option. And lastly, I don't want us to be discouraged as women. You may think you're not being recognized, but I believe that the how do I put it? The what you're doing is actually coming out. When you see less diseases in our communities, and you see children healthier than they used to be, malnutrition, everything taken care of, you'll be shocked, and you'll be surprised that it's going to come back to you as a woman. You'll be so happy to see healthy children. So I want us to keep pushing, and then also thank you, Dr. Reda, for every opportunity your team has been giving to the women generally, and not just the Nigerian women. So that's it. Thank you. Over from me.
Thank you very much indeed, Boma Otobo. Amina Abubakar Isa writes, so she's a registered nurse in Kano State. She says, women's involvement will really go a long way in immunization because they're closer to the children and even spend more time with them. The same woman can also educate her fellow woman in the importance of immunization. So what I hear there is perhaps a project that within the collaborative that could be led by women, focused on peer education between women, between mothers, perhaps. I also want to welcome those of you who are joining late for this consultation. We appreciate your participation. We know there are many challenges and barriers to actually being able to attend even an online meeting. Selina Iniyoha, who says women should be encouraged to participate in this collaborative program. So Selina, my question to you would be how? If you'd like to answer that, please raise your hand. We'd love to hear from you, as well as Amina Abubakar Isa. Selina says no woman will want to lose her child. Even when some husbands refuse immunization, some then hide and bring their children for immunization. Women are more influential in the rearing and care in the family. So you then clarify, you mean the children. Understood. And Fatima Husseini says, has an observation to share. We should not involve politics. So that is what we have so far. Let me just go a little bit while you think about and consider raising your hand. This is how we know that you'd like to request to speak. Remember, this is really about listening and learning together, and in this case, specifically with only women in the room. Just to remind you what we did together. What is the collaborative, first of all? So really based on the research and development by the Geneva Learning Foundation. But in Nigeria, what we did was we worked with an amazing group of alumni and ambassador, many of them women, health workers at all levels of the health system, who participated first in the global movement for Immunization Agenda 2030. Now, on the 2nd of August 2023, we first appointed a set of these remarkable individuals and leaders as alumni ambassadors. So alumni representing the alumni of Nigeria from the movement for Immunization Agenda 2030. Now, within the context of the collaborative, we also had a remarkable group of guides on this side. Now, thinking about it, we had 1, 2, 3, 4, 5 of the guides who were women. Out of the group. And with the first peer learning exercise, we really demonstrated the potential for large-scale digital peer learning to address local challenges across Nigeria. However, you can see here that only 38% of the participants in the collaborative have been women so far. So that is an open question for you, is how can we do better to ensure and support the participation of women? So we're going to see some great written comments. So I'm going to, let's see if we can hear some more of your voices after sharing these excellent comments. Let me just see, let's see if we can go to, let me see, first of all, Joy Kalu. Joy Kalu, you had some very specific suggestions, we'd love to hear from you. I'm asking you to unmute. Amina Abubakar Isa.
Hi, good afternoon. Thank you. Good afternoon, everyone. Thank you for this opportunity, Dr. Reda. Hello, can you hear me?
Yes, loud and clear. Don't forget to introduce yourself, and we'd love to hear your thoughts. What could we do? What should we do, and why?
Okay, my name is Carlo Joy Mba. I'm a public health expert. Okay, and a former an ambassador to TGLF. So it's a pleasure speaking to everyone right now. So now coming to what can be done, or what if the collaboration can amplify. What's the question again? Sorry, please let me read it through. Okay, how can the collaboration help women be recognized as leaders in immunization work at all levels? I think there should be a platform where these women who are into immunization are recognized. Maybe an award, some award given to them, or some seminars or workshop or conferences be organized in respect to their hard work. Okay, where we have some of our leaders, the government officials in attendance, and so that the government can, on their own, say what they can do to better the lives of these women. Because we know in immunization, personally, I am a lecturer, but I engage in immunization campaign because where I work is not an urban city. I think it's a semi-urban area, and most of the times you get to hear these mothers talk about immunization. So we had to go to their various sources to do campaign, to sensitize them on the needs of this immunization, okay? And at the end of the day, we're able to create some awareness, which they end up buying our opinions and bringing out their children or their voice for immunization. So I think there are some platforms where women are being recognized and are being kind of appreciated for the work they are putting in immunization. I think it will go a long way to appreciate that. It will go a long way to appreciate our work. Okay. Now, for what the collaborators can do, I think the collaborators too, once in a while, not just these online meetings that we usually have. I think having a physical meeting, it goes a long way too to appreciate people. Okay. Now, when I get to attend some conferences, I get to do networking, and you and I know that networking is a key ingredient in career development and advancement. Now, if we have some physical meetings where we meet ourselves, then you get to learn and share from people's wealth of knowledge. I think it will go a long way too to appreciate these women in immunization. That is on the part of the collaborators. If they can organize a physical meeting where the women they meet, okay, it is a good one. For me, it is a good one. So that's it. Thank you very much.
Thank you very much indeed, Joy Kalu. And I imagine you mean both both types of meetings, one with women and men, and then one specifically that would support women to meet and support each other. Is that correct?
Yes.
Okay. All right. Thank you, Joy. Let's go to to Amina Ibrahim. Amina Ibrahim, and actually Amina Abubakar Isa first. Amina Abubakar Isa, please. You shared this. You said women's involvement will really go a long way, and you emphasized the role of women as mothers and the role of the role of women as peer educators. So really teaching other women, learning together about the benefits of immunization. Can you tell us, first of all, introduce yourself, tell us what you do, where you work, and then tell us what you're describing here. What could or should the collaborative do to support this peer education between women about immunization?
Okay, hello everyone. I am Amina Abubakar Isa. I'm a registered nurse from Kano. I worked at Federal Neuropsychiatric Hospital, Douano. Though now I'm presently not working because I'm furthering my education. So what should the collaborative do? To me, I think involving more women than men will go a far way, because women are the one closer to the children. When you involve women, educate them, show them the evidence of the importance of immunization. What I mean by the evidence, that means show them the outcome of the immunization. This is the outcome. When you did the immunization, this was the outcome, and lack of the immunization, this is also the outcome. So when you show them evidence, they will get to know more, not just telling them this is it, this is it, this is it, but show them these are children that have been immunized, and these are children that have not been immunized. Let them see the difference and understand. I know every mother would like to see their children to be healthy. So when you involve women, these women will be mothers, can be aunties, sisters. All these women can fall in any of these categories. They want to see their children or younger ones healthy. So I don't think if they want to see their younger one healthy, they will deprive them from immunization. So when you educate more women, the women will educate other women. That's how the channel will go. Educate one, she will educate another one. Then that's how it will continue, educating more and more and more. And when you educate them, in the process, show them reason why they should believe what you are saying. So there will be a change in the immunization, because these women stay much time with the children. And I am also a mother. When I take my child to the immunization, I always see women bringing their children. I never see a man bringing his son or daughter, because they're always at work. So women are the one going. Women are the one taking their children there. So bringing them closer, making them understand, and showing them evidence, I think it will go a long way. Thank you.
Thank you very much indeed, Amina Abubakar. Issa, let's hear now from Amina Ibrahim. Amina, please go ahead.
Hi, can you hear me?
Loud and clear.
Okay, thank you. My name is Amina Ibrahim, and I'm the Chief Financial Officer at the Life We Desire Foundation. So I would like to oppose what my namesake Amina said, because yes, women are at the forefront of taking their kids to the hospital and all that. But one thing I wanted to understand, let me take the Northern Nigeria as a case study. In Northern Nigeria, most women are more involved in their kids' health rather than the men. So I think this is as a result of unawareness. Let's say the men are not aware, they're not informed, they're not really a part of what the health challenges that the kids are facing. Usually the women are the ones that are usually informed and aware. So why not let's try and make the men aware of all this. And I'm sure if a man, as the man of the house, if you're aware of this and you understand the implications and the repercussions of, let's say, not immunizing your kids or immunizing them, they, as the head of the family, can influence positively in the family, let the wives take part in whatever immunization is taking place or any of their kids' health challenges. So men need to be involved. They need to be part of it. Let it not be like it's only the women that usually it's usually a woman thing. No, it should be a both gender need to be involved in their kids. It's a responsibility on both of them. It's not supposed to be on the female alone. The men also need to be part of it. So please, we need to involve the men, especially like I said in Northern Nigeria. In the other parts of Nigeria, you can see the men are a part of their kids' activities, either in school or let's say the health challenge. So please, we need to involve men in these kind of things. I think that will really help in moving our vaccination agenda forward. So that's all I have to say.
Thank you, Amina Ibrahim. So question for you, do you see a usefulness, is a meeting like this, which is intended to provide a space where women can speak as women and with other women, do you see that as useful, or is it unnecessary from your perspective, and women and men should be together at all times?
Okay, it's very necessary because every woman has her own experience and exposures. So meeting one-on-one like this is really a key ingredient in, let's say, this kind of things that we do, because every person has their own narrative, they have their own experience. Once they come here and let's say narrate their own problems or their solutions, it's actually a safe place for every other person to understand and act upon what they feel is okay, or they can deliberate on how to move forward on it. So I think it's actually important to have everyone come together, all the women come together and speak on this.
Thank you, Amina Ibrahim. Let's now go to Patience Euman. I'm not sure if I'm mispronouncing your name, Patience. You'll correct me if necessary. We'd love to hear from you as well. Don't forget to introduce yourself. Tell us who you are, where you work, and then what's on your mind. What would you like to contribute to this consultation, to this debrief following the first peer learning exercise, and really intended to get to provide space for women to share their specific experience as women of the collaborative.
Good afternoon, Reda. My name is Ihuman Patience. I'm a pharmacist and then a public health expert as well. So from the collaborative, I've been given the opportunity to really study more about vaccines, because I've not really been in the vaccine world. It's just been about drugs and then other health promotion activities and all. But through the collaborative, I got to understanding, not just from my own point, but also that of my peers, of the hindrances to immunization in Nigeria as a whole. And that has made me to want to really be involved in this whole vaccine promotion rather than sticking to just one aspect of health promotion and all. And then I would suggest that it's been nice we take this from just an online meeting to something physical, as that would actually foster better engagement. That's my own suggestion. And then I would also suggest that women who are already working to promote this vaccine be shown some recognition, as that would actually make them do more better, or do better in what they've already started. Thank you.
Thank you, Patience. And so, all right, thank you. Let's go now. There are many more hands raised. Josephine, Alex, Abedo. Josephine, over to you, asking you to unmute. And then, okay, Josephine's not responding, at least not right away. So let's go to Zara Abubakar Otaru. Oh, I think, yeah, you tried to unmute. Sorry about that. I may have prevented you. And of course,
hello, everyone. Good afternoon, Reda.
Yes, a warm welcome. Good to reconnect. What's on your mind in this consultation, where women are really sharing, specifically with women, feedback and thoughts on what the collaborative has done so far, and what the collaborative could or should do to support women in the future?
First, I'll start with commending the women. We're doing a great job as mothers, as sisters, as aunties, as grandmothers, just as women as we are, because we are making a very big impact in raising the next generation of women. I am coming from a health educator, a public health educator perspective. And I can say that I am impressed with my female students. They try their best. Some are mothers, some never got the opportunity to study when they were younger, and they are there making sure that they do whatever it takes to see that they succeed in their capacity as women. They're not letting the general stereotype of being a woman hinder them from progressing or being successful in whatever they are committed to do. And it's something that I know it's we women that are raising these women, and I want to commend us. For the collaborative, I'm so glad, I'm so proud to be part of this, and it has really impacted me positively. It has given me a new perspective to see things, because I'm just from my little classroom, but these are women. I'm communicating with women that are on the field every day, morning, afternoon, evening. Sorry, please excuse me. Sorry, excuse me.
I think we may have just lost Zara.
I'm back. I'm back.
Okay,
I'm back.
yes.
I'm back. Yes. Thank you. This collaboration has given me the opportunity to meet other women, to communicate with other women. I get the experience from other women who are on the field, and it's also an opportunity for me to improve my teaching skills, because even though I'm not mostly on the field, because I think my field experience is 10% to classroom experience, but I have first-hand experience that I can use to teach my students, and that it motivates them more to after learn, because I teach community health workers. So they see positive reasons to or motivation, and they are committed to what they ventured in. Like they have reasons to be proud of what they are planning or what they are studying to venture in. So this collaborative has given me a great opportunity to, and I'm so glad to be here. That's all. Please continue with what we are doing, and there's still room for improvement, but so far this is great, and I'm so proud of the collaborative so far. Thank you so much. Yeah.
Thank you very much indeed. And indeed, it's impressive what Nigerian health professionals have been able to do in just a few weeks. And in particular, what the reason we held this specific consultation is because we observed that many women, including those who are in the room right now, displayed exceptional leadership. And we saw that there was a specific voice and commitment, and that really needed to be recognized, and also that we should listen to you. So next we're going to listen to Josephine Alex Abedo. Josephine, please go ahead. I think if you're still not able to, okay, here we go. Yeah, do introduce yourself, and then share, here we're specifically interested in your experience as a woman, your perspective on some of these specific questions. How can the collaborative help women be recognized for their leadership in immunization work at all levels? And what could or should the collaborative do to better support women in the collaborative?
Yes, thank you very much. My name is Josephine Alex Abedo. I work with Nigeria Institute for Trypanosomiasis and Onchocerciasis Research. Although I've not been working much on immunization, but I have worked with the nature of my work. I work a lot with women. I evaluate the status of these tropical diseases in communities. So I work with women a lot. So this collaborative is very, very important. How this collaboration can recognize women is to maybe have a platform where women can come and talk about their work, their experiences, and their what they have done in the field, and then so that they can now share their challenges and experiences. With that, I think that is another way that this collaboration will help women to become better leaders. Then again, those that are doing well in the field should be recognized. Recognition by giving them, involving them in a lot of things, similar works that will enhance their knowledge. And again, there should be a platform, just like I said earlier, there should be a platform that will bring these women together so that they can share their expertise, they can share innovative ways of doing things. Because maybe the way you are solving your own problems in some regions might be different from what you are doing. So when you come together and share ideas, innovative ideas, it will enhance each other's work, and from there, it will bring a lot of recognition by the government and other people around too. They will know that people are doing work that is worth emulating, or things that will, activities that will enhance the immunization work. So that is the bit I want to contribute now.
Thank you very much indeed. And in listening to you and in the discussions in our team, we're well aware that in Nigeria there are already existing platforms, existing networks led by women. There is a history of different types of movements led by women, and so we want to recognize and respect that. And certainly we would, before creating anything within the context of a collaborative, would also first look for opportunities to connect with existing initiatives that members of a collaborative may already be involved in. But of course, we want that specific focus on progressing towards the immunization goals. So thank you.
Yes.
We've heard some remarkable insights and sharing so far. I want to go to Oluton Sanusi Oladuni. Please go ahead. I'm asking you to unmute. I hope we'll be able to hear from you. And we have only a few minutes left in the collaborative now. After this meeting, we'll share the recording for anyone who missed some or all of it. And then we'll also share a link so that you can share your written comments and give us more specific feedback and recommendations, including feedback that you don't feel necessarily comfortable sharing in this meeting. So Olutun Sanusi Oladuni, a warm welcome to you. Please don't forget to introduce yourself and tell us, you may be our last or next to last speaker, what's on your mind with respect to women's leadership in the collaborative.
Hello, Ryder. Hello, everyone. Nice to be here once again. Thank you for the opportunity to speak. So I've listened to what everyone said, and it has been very great input and all of that. But what I wanted to add really to what every other person has said is we need to give the women within the collaborative and all those we are actually aiming to bring in more responsibilities. Now, why do I say this? For a woman to be in the collaborative, and I'm happy that you said you have some ambassadors within, I would have loved to know how many women are actually ambassadors. So if we give them more responsibilities and we portray them as leaders within the collaborative, people trust women very easily, especially when it comes to healthcare. And then our focus really is immunization, and women are much closer to children and have more empathy when it comes to immunization. They understand what it means. And if as a woman, I go into a community and I want to immunize children, the parents within will at least regard me more because they will feel like, okay, I'm a woman, I probably have my own kids, and I will not do something that I can't do to my own children, right? So that trust is already like ingrained in that relationship and in that strategy. So if we give more women opportunities and they are leaders within the collaborative, and we portray them as such, and we give them responsibilities, and not just responsibilities, we empower them, and we show that we are backing them up. There's no way our strategy will not work, right? And our point really is to ensure that children in communities, especially underserved communities, are attended to, and they get immunization as at when needed. So if we push women to the front, and we as a body, as a collaborative, that's Geneva Learning Foundation and every other person in that space, UNICEF and all, everyone who came together to make the collaborative a success. If we push it that we are backing up women, they are our ambassadors, and then we are giving them leadership positions, I believe it will result in more productivity, and we'll see results much faster. Thank you.
Thank you very much indeed. All right, we're going to go a little bit over time, but there are two more women with hands raised. I know Tina Iragoma Agbonimia is another exceptional leader within the collaborative and also within the TGLF network in Nigeria. So Tina, I know you've had your hand up for a long time. I hope that hasn't discouraged you. I'm asking you to unmute now. And then also Selina Eni Yoha. Yes, go ahead, Tina, and then we'll hear from Selina, who will be our last speaker. Oh, Tina, your microphone is unmuted, but we are not able to hear you. So let's go to, let me see. Let's go to Selina.
Mm-hmm. Hello?
Yes, go ahead, Selina. Then you'll be our last speaker. It looks like Tina has a technical issue,
okay.
So please go ahead.
I'm really pleased to be in this forum. And as I mentioned earlier, it is always good for women to be the people to take their children for immunization because they are more committed, because no woman wants to lose the child. And another thing I want to say about this collaborative is, if it's possible, could we involve teachers, because during registration of children in schools and the demand for immunization cards, that will motivate parents to remember that their children should be immunized. I remember a case where one of the ambassadors was outside the country, and the children, they forgot their immunization card in Nigeria. They did not allow them to go to school. Because of that, they had to come back, and we had to start filling another form for them. So if we can make such a thing compulsory, that in schools, that the children must bring their immunization cards, it will motivate mothers to remember that they should immunize their children. Then we not only call it, I'm suggesting we shouldn't call this an only collaborative. We should call it Mothers Immunization Support Group. And like people have been suggesting, if we can have a platform where people can interact and discuss their challenges and their experiences, that will really be very wonderful. Thank you very much.
Thank you very much indeed. All right, we are at time, so I wish to thank each and every one of you for joining today. For those of you who did not get to speak today, you'll see in the follow-up message we will share a link. And the link allows you to submit a written contribution, so you can also in writing write up, and we are also saving and keeping the chat as a record of what you told us today. So we really are appreciative for your time, for the inputs you've given us, and really for the impressive leadership that you displayed throughout the first few weeks of the collaborative. We're now doing the debriefs and the after action review with UNICEF and the NPHCDA. With NPHCDA, we agreed to present the collaborative at one of the NERIC daily meetings. So we'll be looking to UNICEF and NPHCDA, who of course are in the country to do that. So there is certainly official recognition and support for this initiative, endorsement by NPHCDA, and this partnership with UNICEF, which is really providing that really has that countrywide presence. So we're taking our time to do things right. We're also engaging with Gavi, that has taken note of this initiative and its uniqueness in the landscape of Nigeria, where there's so many initiatives around immunization. So once again, wish to thank you. We'll keep you updated. And again, if you did not get to speak or contribute today, or if you have additional things that you'd like to share, look for the follow-up message that Charlotte will be sending with a link to share your written contribution. Wonderful to reconnect with you. I'm honored to have been by default your facilitator, and thank you for accepting my facilitation role today. Thank you and goodbye.
Bye. Thank you.
Thank you.
Yes, for Nafisa, we're about to send out the invitation for the commencement event. So you will be invited to the commencement ceremony. We'll read every name of every individual who has successfully completed the first peer learning exercise. Will also be for Rose Daniel, who's asking for the recording. Yes, absolutely. We'll be sharing that in the follow-up email together with a link for anyone who missed some or all of it, or just wants to review again. For the commencement event, as I said, this is going to be the next big event where everyone will be invited. We've seen incredible participation in the previous events, but this time we'll be honoring those of you who have successfully completed the first exercise. And again, yes, indeed, I see most of you are still in the room. Just want to remind you, the sort of women, inspiring women, that collection is available with strong representation from women from Nigeria. And then the Women Who Deliver Vaccines Collective, that is at the global level, many with, again, a strong participation and presence and leadership from women of Nigeria. And then for anyone who'd like to know more about the ambassadors, you can watch and learn more on this page. So those are the links we wanted to share with you today. Thank you once again, and goodbye.